Hi, my name is Carlo Blaquera.
My name is Dana Colorio, and our clinical question is strength training more superior than yoga in improving bone mineral density in postmenopausal women with osteoporosis. Osteoporosis is a systematic skeletal disorder that illustrates a low bone mineral density in the body. Treatment options such as strength training, weight-bearing activities, and yoga all have effective outcomes to help produce the most optimal results in this patient population.
For our search criteria, we addressed our clinical question using PubMed, Medline, and Sage Premier databases. The following keywords were entered in our databases, such as bone mineral density, osteoporosis, yoga, strength training, postmenopausal woman, and osteoporosis. We ultimately narrowed it down to 7 articles, 4 of which were systematic reviews.
The limitations of our study were lack of head-to-toe analysis of yoga versus strength training. All but one study addressed diet and nutrition in the participants. Presence of confounding variables such as vitamin supplementation, diet, and lifestyle activity were not addressed among the participants. Other comorbidities, financial and physical accessibility, and patient motivation and compliance. The conclusion of our study was a combination of resistance, strength training, yoga, nutrition, and patient education would produce the most beneficial outcome of increasing bone mineral density in postmenopausal women. It is imperative to change old habits, practice a sustainable, healthy, and balanced approach to living, and patients should start by implementing minor changes into their daily routines. Finding an approach to physical activity that makes them feel their best and continue to stay motivated to be consistent in.
The results from our articles are as followed. We saw that long-term outcomes showed similar results for both strength training and yoga in improving bone mineral density for postmenopausal women with osteoporosis. Literature demonstrated that more significant results were obtained in groups that are addressed nutritional intake, as well as participated in an equal combination of both strength training for 3 times a week and yoga also for 3 times a week. However, studies failed to define the protocols that defined what type of strength training protocols were used. Further results need to be conducted to directly compare both interventions. For our recommended doses for training, we found that improvements in bone mineral density were noted with intensity of 70 to 90% of 1 RM for 2 to 3 sets of 8 to 12 repetitions regarding strength training. As for yoga, each pose should be held for a minimum of 30 seconds each and performed daily. Duration of both interventions should be at least 1 year for changes to be noted in bone mineral density.